Thank you for watching the video. This is YouTube. Rheumatoid arthritis is not just a disease that causes joint pain. If left untreated, your fingers may become deformed, making it hard to enjoy hobbies, travel, or cooking later in life. Additionally, ongoing inflammation can raise your risk of future heart vessel blockages or cause serious, potentially life-threatening complications in your lungs and other organs. It is estimated that there are between 500,000 and 1 million people with rheumatoid arthritis in the country. Rheumatoid arthritis, autoimmune and collagen diseases may seem understandable, but they're actually complex. Let's hear from a medical professional who treats these conditions regularly. I will explain it in an easy to understand way from the perspective of a doctor. At the end of the video, I also talk about lifestyle habits to help prevent and avoid worsening rheumatoid arthritis, so please watch until the end. Here at YouTube Medical University, we responsibly share videos from a doctor's perspective that can help you become healthier starting tomorrow. I would be happy if you could subscribe to the channel. So, in the first lesson, I will briefly and simply explain what kind of disease rheumatoid arthritis is. In the second lesson, I'll cover 4 unexpected rheumatoid arthritis symptoms. The third lesson will provide an overview of rheumatoid arthritis. I'll also discuss treatment methods and, more importantly, lifestyle habits to prevent or stop the condition from worsening. Rheumatoid arthritis is called an autoimmune disease. Autoimmune disease. It sounds complicated with all those kanji, but it's actually simple. Normally, we have an immune system to fight off germs. An autoimmune disease is when that immune system mistakenly attacks your own body. In rheumatoid arthritis, your body mistakenly attacks its own joints, specifically targeting the tissues shown in this image. It's said that the joints become painful because inflammation occurs in a membrane called the synovium. It's said that women are 3 to 5 times more likely to develop it than men. Genetic factors are noted, so having relatives with rheumatoid arthritis is thought to raise your risk. Most patients are women in their 40s and 50s, with numbers rising as they approach middle age. It's good to keep that image in mind, but in reality, when seeing patients in outpatient clinics, there are actually many men as well, and both young people and the elderly can develop it. Please don't forget that it is common across various age groups. Now, in the second part, I'd like to explain 4 unexpected symptoms of rheumatoid arthritis. If you don't notice these symptoms and leave them untreated, the inflammation can progress. Deformities in your hands can worsen, and in the worst case, it could even become life-threatening. Please listen until the end. The first of the 4 symptoms of rheumatoid arthritis is joint symptoms. Let's start by reviewing the basic joint symptoms. Rheumatoid arthritis is mainly characterized by hand stiffness, as noted in several YouTube videos. Hand stiffness can also result from deformities caused by overuse, and conditions like diabetes can make the hands contract and stiffen, leading to stiffness. So, what are the specific characteristics of stiffness caused by rheumatoid arthritis? There haven't been many videos that explain this in detail. A characteristic of rheumatoid arthritis is morning stiffness, and this stiffness typically lasts for more than 30 minutes. When you wake up in the morning, your joints feel hard to move, but after a while, they get better. If you're asking if this stiffness is typical of rheumatoid arthritis, it's not. Because it lasts 30 minutes, you still feel some stiffness during breakfast. You feel stiff while cooking in the morning, but notice improvement by noon. These symptoms may indicate rheumatoid arthritis. About 90% of people with the condition have them, so check if you experience any. The distribution of affected joints is also characteristic. The most common are the joints of the fingers and wrists. It's also typical for symptoms to appear symmetrically on both sides. Joint pain on just one side may suggest a different disease, not rheumatoid arthritis. Another key point, rheumatoid arthritis rarely causes pain in just the first joint. If only the first joint is painful and swollen, such symptoms could be a sign of Heberdin's nodes. Heberdin's nodes are also This disease has key points to note. I've summarized them in a previous video. Check the description below after this. In addition to hand joints, you might feel pain in your knees, ankles, shoulders, and other joints. If you notice new, gradually worsening joint stiffness, as I mentioned, in such cases, rheumatoid arthritis is especially suspected. Please consider seeing your regular doctor, or if there's a hospital nearby with a collagen disease or rheumatology department, think about getting checked there. As you become more familiar with it, you'll notice that your joints are more swollen than usual. When you touch them, the joints feel soft and puffy, and it hurts when you press on them. By examining yourself this way, you'll be able to notice these changes. The second of the four main symptoms of rheumatoid arthritis is skin symptoms. Isn't that surprising? Seeing is believing, so please take a look at this image. This is called a rheumatoid nodule. Its characteristic feature is the formation of these lumpy nodules or masses under the skin, and it's said that about 20 to 30% of people with rheumatoid arthritis develop them. They often develop on the back of the head, knees and elbows, areas frequently exposed to pressure or irritation. It might be easier to remember if you think of it as the inflammation from rheumatoid arthritis affecting not just the joints but also the skin, leading to the formation of these nodules. Here is the third of the four main symptoms of rheumatoid arthritis. These are systemic symptoms. What kind of symptoms are systemic symptoms? They include feeling generally sluggish, having a low-grade fever, loss of appetite, and slight weight loss. These are the kinds of symptoms you might experience. Why do these symptoms occur? It's easier to understand if you think about the reason. These symptoms are caused by your immune system constantly being in a state of battle. The immune system wrongly identifies joints as foreign and stays activated. Because of that, your body gets exhausted, you feel tired more easily, you lose your appetite, you feel sluggish, and inflammation can cause a fever and various other problems. In this way, if people with rheumatoid arthritis don't have very strong joint pain, they might not mention it themselves and just come to the hospital saying they feel kind of sluggish, making it hard to diagnose. Eventually, the joint pain becomes stronger and they are diagnosed with rheumatoid arthritis. This happens quite often. If it takes a long time to get diagnosed, their fingers may become deformed. Sometimes, a lot of unnecessary tests are performed. Please check yourself for the symptoms I talked about today, and if any of them apply to you, consider visiting a hospital. Here is the fourth symptom of rheumatoid arthritis. It's having a persistent cough, rheumatoid arthritis, and coughing. How are they related? This happens when interstitial pneumonia or pneumonia occurs together. Autoimmune diseases, including rheumatoid arthritis, can sometimes be accompanied by a condition called interstitial pneumonia, where the lungs become stiff. When the lungs become stiff, oxygen and carbon dioxide exchange is impaired, causing shortness of breath with minimal activity. You may develop pneumonia and a chronic cough. These issues can occur. This is the same condition that affected the famous singer Yashiro Aki. It was interstitial pneumonia caused by one type of collagen disease called dermatomyositis. Some of these conditions are truly serious and can be life-threatening right away. Sometimes someone hospitalized for persistent coughing is diagnosed with interstitial pneumonia, and during that process, a collagen disease is also found. Remember, a persistent cough could indicate a collagen disease or autoimmune disorder. In the third part, I'll discuss how to prevent or slow rheumatoid arthritis by focusing on key lifestyle habits. For rheumatoid arthritis, hand x-rays or ultrasound are used. Blood tests are done to check for antibodies, and ultimately a diagnosis is made by considering symptoms and other factors. If you are diagnosed with rheumatoid arthritis, there are now many treatment options available. If treatment is started early and goes well, many people are able to live stably without significant deformity of the finger joints. In most cases, medications are used to suppress joint inflammation. There are various treatments, including biologics and steroids. To help prevent rheumatoid arthritis or its progression, healthy lifestyle habits are key. Here are 4 important ones. Here are 4 lifestyle habits to prevent or slow the progression of rheumatoid arthritis. The first is to quit smoking. As I said earlier, rheumatoid arthritis is caused by heightened immune activity, leading to inflammation and greater blood vessel damage risk. People with rheumatoid arthritis. There is also data showing that patients with rheumatoid arthritis have a higher risk of developing diseases where the blood vessels in the heart become clogged. For these reasons, smoking also causes damage to blood vessels. It's always better to quit smoking. In fact, smoking increases the risk of developing rheumatoid arthritis itself. It can even reduce the effectiveness of some medications. Smoking is a major enemy for people with rheumatoid arthritis. Having this awareness is extremely important. To prevent or avoid worsening rheumatoid arthritis, here is the second of the 4 recommended lifestyle habits. Being mindful of your immune system. While this may seem obvious, for autoimmune diseases, it's important to maintain a healthy immune system. There are usually no strict dietary restrictions. However, people with rheumatoid arthritis are more prone to osteoporosis. To help prevent it, exercise, get enough vitamin D, and consume calcium. And something that is often overlooked is periodontal disease. Having periodontal disease actually means that there is constant inflammation in your mouth. Rheumatoid arthritis also involves inflammation. It is considered important to not only control rheumatoid arthritis, but also take care of periodontal disease. And fatigue itself can also increase the risk of symptoms getting worse. Make sure to get proper sleep and take mental breaks. Don't forget these basic forms of self-care. The third of the 4 lifestyle habits to prevent and control the worsening of rheumatoid arthritis is physical therapy. It's important to use heat and cold effectively to reduce inflammation and stimulate the joints. When joint inflammation has subsided, it's said to be important to use heat therapy, such as applying light or ultrasound to warm the area. On the other hand, when inflammation is severe, instead of warming the area, cooling it can help reduce pain and inflammation. So, don't rely only on medication. Make sure to use heat therapy and cooling effectively to manage your symptoms. Lifestyle habits to prevent or avoid worsening rheumatoid arthritis. The 4th point is this: avoid putting strain on your joints. Even sitting on a low seat when standing up or sitting down can add strain to your knees. Western-style toilets are easier on your joints than Japanese-style ones. They put less strain on your joints. It's important to remove things from your daily life that tend to put stress on your joints. Taking care like this helps prevent joint pain. And it's important if you want to stay active and healthy later in life. Also, sitting on a chair is easier on your body than sitting on a tatami mat, right? When pain is strong, don't force use. Use supports to limit joint movement. These adjustments are important. Use supports, assistive devices, or braces to build habits that avoid joint stress. Because this is personal, I suggest talking to your doctor if you want to discuss it. How was it? Today, we discussed rheumatoid arthritis, which can be dangerous if untreated. I explained what kind of disease it is, its unexpected symptoms, as well as treatments and lifestyle habits for prevention. Rheumatoid arthritis doesn't just cause joint symptoms, but also skin symptoms, lung symptoms, and even general fatigue throughout the body. And if you leave these symptoms untreated, your joints can become deformed, and in the future, your risk of clogged heart vessels or osteoporosis will increase. And to prevent these, it's important to get proper treatment, quit smoking, regulate your immune system, undergo physical therapy, and adopt lifestyle habits that protect your joints. I've said this is important. Please share your symptoms, your doctor's advice, or anything you'd like to try in the comments if you have something. This may help other viewers too. Please rate this video with a thumbs up or down to support us. At YouTube Medical University, we make complex medical topics easy to understand from a doctor's perspective, helping you become healthier. It would really encourage us if you subscribe to the channel so you don't miss any new videos. Well then, see you in the next video. As a general practitioner, I've learned from patients how to live agelessly after 70. This book became a bestseller in 4 Amazon categories and topped the gift rankings. In my daily work as a doctor, I've compiled into one book the important ways of living and health tips that I've learned from my patients. I also want to live a healthy life like this. That's the kind of book I've created. It's on sale now and has been very well received, so please check it out.